I'm Mitchell Chase. Did I tell you that? I told you that, Doctor. There we go. I just want to make sure I got that in there. Right now with me, a good friend of the show is Dr. Pruthi from Antelope Valley Hospital. It's great to have you here.
Good to see you.
It's that time of year again. It's a National Colorectal Cancer Month?
Awareness Month. Yeah,
Awareness.
March is Colorectal Cancer Awareness Month. And we do a lecture every year in March to bring the awareness, to make the public more aware of colorectal cancer so they can come and get the preventive studies done.
All right, so it'll happen on Thursday. What's the time? Is it 6?
6:30.
Yeah, and it's real easy to find. Just go up the elevator. I think it's on the 3rd floor.
Yes.
The 3rd floor, and a big conference room that's there. And we're talking about that you can get to it right off of 15th Street West. What's that? It's right before the
AVOIC building.
Thank you. The imaging building.
Imaging building.
Imaging building. It's right up there, 3rd floor. Go up there. Now, this year, have things changed? There we go. It's up on the screen so you can see where to go there. This year, is there anything new that, or on the cutting edge?
Lot of things actually, but we got to go to the basics first. What is colon? What is colorectal cancer? Make public aware of it first. Colon is a part of the large intestine. It's a large intestine basically. When we eat food, it goes through the mouth and the esophagus into stomach, then into the small intestine, and then where the small intestine join the large intestine, that is called colon. So colon is about 5 to 6 feet long, starts from the right side, goes all the way to the rectum. Colon normally absorbs water from the waste material. So when we eat food, it goes through the digestive system process, and by the time it reaches colon, all the nutrients have been absorbed, the waste is in the colon, it's processed further, and then eliminated. So colon is a large intestine, and if there is a dysregulated or unchecked growth of any tissue in the colon, that becomes tumor and cancer.
What causes those growth?
There are a lot of things. There are people at average risk for colon cancer or people at more than average risk for colon cancer. Average risk is everybody at age 50, is above age 50 is average risk. Now people who have family history of colon cancer, particularly the first degree relative have a colon cancer, or there is a high intake of animal fats, less intake of vegetable or plant source of food, smoking, obesity, diabetes mellitus. So these are some of the risk factors which are considered to increase your chances of getting colon cancer. And some of these are causative factors also.
How does, when you eat vegetables or you have fiber or whatever, how does that specifically help in the large intestine?
We don't know the exact mechanism, but it looks like they absorb the carcinogenic toxins. And then the fiber kind of keeps the colon well cleaned out and moving better.
Is it almost, does it like
This kind of
brush it
brushing
out?
kind of mechanism, yes. So the fecal matter is not attached to the wall of the colon for years, and so the toxins are absorbed with the fiber.
All right. When you, let's look at it as far as the Antelope Valley, right? Mm-hmm. How, what's the prevalence of colorectal cancer in the population here?
Population-wise, overall, in all over the country, about 150,000 people get diagnosed with colon cancer every year. And about 50,000 deaths happen from colorectal cancer every year. And the data is same for our area too. But western region of the country, the incidence and mortality rates are a little bit lower than the northeast. But this is one of the most preventable cancers. See, normally the colorectal cancer starts as small polyps. So there is a small little growth that starts to happen in the colon. The cells start to multiply, and then they grow into like a mushroom-like polyp. They may have a stalk or they may not have a stalk. And then slowly this polyp over years turns into cancer. So now we have a window of opportunity there. So we can intervene, go in and remove those polyps or early cancerous growths and decrease the mortality. And over the years, the incidence and mortality has been slowly going down.
All right. Well, your lecture is coming up Thursday. It'll be at 6 o'clock at in the imaging building at Antelope Valley Hospital. And right now, about how many patients are you treating that do have suffering from colorectal cancer?
We have quite a few patients. Lot of patients. We have a lot of catchment area for Antelope Valley Hospital. We get patients from all over up to Ridgecrest, Boron. So we have a big catchment area on this side. So we treat quite a few patients. Yeah. Exact numbers, I don't
that's okay.
have the exact number.
Is it common, or is it normal practice if somebody has colorectal cancer, you go in surgery right away and cut it out?
Yes, depending on the stage. For example, patients come who are asymptomatic, no symptoms at all, and they are average risk, come for screening. We find polyps. They are small polyps or a small tumor. We do colonoscopy and remove them right then at the time. And this complete resection is gone. Now, if we find that there is a cancer that is going deeper into the wall of the colon, then we stage it. Depending on the staging of the cancer, we decide patient needs surgery, chemotherapy, and then further follow-ups.
All right, well, good. Dr. Pruthi, thank you so much for coming in, and look forward to the lecture. The information was up there on the screen. Dr. Pruthi, thank you very much.
Thank you so much.
All right.